So this practice is for our often forgotten parts of the lower extremities. Toes, ankles, knees, and hips. We're so used to stretching the backs of the legs and the fronts of the legs and all the rest of it that we sometimes forget that we want to keep mobilizing through specifically the joints, right? And that will help the whole chain, especially if you're having, you know, common shin splints or you're having knee issues or anything like that, just making sure that you're paying attention to it. If you have something that you'd like to sit up on, go for it. I like to just have, what's the best angle here? I think I'm gonna be here. Okay. I do this just to elevate my sit bones a little bit so I don't feel like I'm straining and kind of hunching forward. You could also do this practice in a chair, but since we have the yoga mat out, let's do it here. Take your hands behind you and then straighten your toes straight out, your legs straight out. So make it comfortable for yourself. And then from here, flex at the ankles. And then you're going to flare the toes towards your forehead and then reach them out, curl them like you're gonna pick up something with them and lift them up and spread the pinky toe away from the second toe, the third toe, the fourth toe. Really expand and then contract and keep going like that. And you can go slowly and kind of explore the terrain, right? Or you can kind of make it rapid and practice making sure that they have that range of motion. And then from here, let the toes relax. And we're gonna do the same thing with the ankles now. So flexing at the ankles, this is called dorsiflexion, and then pointing, which is plantar flexion. So we're extending, so you think about closing the front of the ankle, and then think about expanding the front of the ankle and going back and forth like that. And then making some circles in one direction. And you want to really kind of focus in on the ankles here, right? So the rest of the leg will move, but you want to get the most mobility through the ankle and then change direction. Ooh, got a pop out. And usually, you know, you will hear those little snap, crackle pops as long as it's not painful. They're actually a good sign. They're a sign you're getting oxygen into bits that are kind of tight. And then coming back again. And then from here, we're going to move in to the knees a little bit. You're just going to bend this knee in towards you and give it a nice little hug. And then let it go out. And then take it the other way. And bringing it out. So again, you could do this on a chair. You could also do this on your back. The reason why we're doing it seated right now is so that I can keep my sit bones down and I can really just focus a lot on the knee. But we will take it down to the floor in a moment. Okay? And then from here, just as promised, we're gonna come to lie down. You can take the blanket and use it as a pillow if you're using it at all. Your knees are bent up towards the ceiling. You want to feel your pelvis stable here. And then from here, you're going to keep both sides of your hips down. Bring the left knee in towards you. You can hold on to the back of the thigh, or you can hold on to the front of the knee if that's comfortable for you. This is going to be the more intense stretch. And if this is too intense, right, you can stay with that seated posture. And also, if you just notice, I flexed up my ankle right there, and that's partly to protect the knee joint. That actually is very helpful. And then coming down, and then we'll take it the other way. Again, you have the option of holding onto the back of the thigh or the front of the knee. But one of the things I should mention is you want the knee not to come to the center line of the body, but rather to stay in line with your sit bone. So basically, the knee is lined up with the middle of the right hip. And then you can just let that release. Good. And then we'll bring it back up. Especially if you're talking about if you specifically have knee pain, this is a great one to start to strengthen the the muscles around it a little bit. Make sure that you're not going into hyperextension at all and putting a little strain in the back of the leg. Just take a rolled up hand towel, or you could use a little pillow or anything that you have that will just kind of give you some feedback. You're going to place it underneath the knee itself. And then from here, you're going to practice squeezing and engaging the quadricep so that the kneecap absorbs up, and then let it relax. And again, pulling in all these muscles right here, and you can flex through the whole leg itself, through the back of the heel, right? Flexing at the ankle, and then let it relax. Let's do that 3 more times, lifting in and letting it relax. And last one. And let it relax. And let's go to the other side. Placing it underneath the knee. And again, you're gonna flex and engage that quadricep up, and then coming back and pulling it in and bringing it back. And last one. And bring it back. All right, we're on to the hips now. This is one you can do seated. I'll show it seated and I'll show it lying down. I love doing it lying down, but if you don't have room for it, always stay seated. You can obviously, better to do it than not do it. I'm gonna turn this way to face you a little bit different of an angle. Okay, so go ahead and slide your right knee in towards you. Keep both sides of the hips down. Take that knee out to the side any amount and slide that foot away. So we're drawing it in, out to the side, and bringing it back. And one last time. That's about 3 times. Good. And then from here, we're going to reverse it. So open it out to the side, pull it in, extend it out. And the benefit, so tricky, of doing the seated is to hold yourself upright. You're using your abdominal muscles. So this is one of those nice little combination things, right, of like how the whole body kind of works together to help itself. So that was 3 on that side. Now from here, you're going to bend that knee in, and then you're just going to hold on to the foot, hold on to the knee, and start to mobilize in the hip. So kind of think about it as the ball and socket joint that it is, right, in your pelvis. You're stirring it around. And when you're doing this, right, it's almost like a self-massage a little bit, in terms of just getting into the joint itself, making sure there's a lot of freedom there. And that feels so good. And then go ahead, give it a nice little release. And we'll do the other side, and then I'll show that lying down as well. Okay, so sitting upright, we're done with you. You're gonna slide that left knee in, keep both sides of your hips down. This hip is gonna wanna lift, and then bring it out and extend it out. So 2 like that. And last one. And then bringing it back in. Now go ahead, we're gonna take it out. And bend the elbow, or the knee out to the side, exhaling. Inhale to bring it, slide it. Exhaling. And last one. Good, and then you take hold of it, you make it like a little, you make a little package out of it, holding onto the foot, holding onto the knee, and then just kind of moving it around in here. And anything you do in one direction, you want to do in the other, and you can be pretty expressive with this. All right, getting it in there. Good, and then coming back and extend it out. I'm going to show that lying down. And if you're just doing this as a sequence, you can go straight through. You don't have to skip one just because you did it. The more that you can move it, the better. Okay, so from here, we're going to keep the pelvis stable. Again, I always like to bring my hands here just because the tactile feel of where my pelvis is in space. And then from here, keep your knees bent. I'm going to slide the left foot away. Open that knee out to the side and drag it back in. So I'm really pressing down on the whole surface of my right foot to stabilize, right? it's not, well, it's not wrong, but you're gonna get the most out of it as opposed to letting that right knee just kind of, right? You want it to be straight up. And then go ahead, we're gonna change direction and bring it back in. And again, you'll start to feel, to open into that knee, or to open into that hip by dropping the knee out to the side, your obliques are actually still working. And then go ahead, bring it into the chest. And then from here, you can take that leg, hold on to the knee, hold on to the foot, and again, we're gonna just stir it around. So we can hold these as static postures as well, right? So if you think about like the figure 4 stretch or something like that. But really kind of moving it, trying to get, kind of stirring it, is helping in a different type of flexibility. And that's what we talk about when we're talking about that mobilization. And coming back, that felt good. All right, let's do the right side. Hips even, arms down. Go ahead, we're gonna slide it out, open it out to the side, bring it up and back. And this is good because you can actually see, right, what I have to stabilize to keep my left knee from kind of splaying out or going along with the ride and moving around the hips, okay? And now we're gonna reverse it. So out to the side, in, up to the ceiling, slide it out. 2 more times. And last one. And then coming in, holding it in, make that little package. You can get that left leg out of the way or you can keep it bent and start to just move it around. Just getting a lot of support with your hands, right, to get that leg to move. And changing direction. And then coming back in, good. And then one final thing we're gonna do, you're gonna bring yourself up, come up to sit. Take your left knee in, open the left knee out to the side, open that left hip out to the side, bring the left foot over the right knee or thigh, okay? Take your hands between your toes, get that web in, okay? And that's a nice stretch in itself, okay? And then we're gonna start to move it. So you're using your arm to move your ankle, the knee is opened out to the side, the hip is facilitating this. Going in one direction. And then go ahead, take in the other direction. Good, and then pulling it in, keep holding on to it. Aha, it all comes together, all the pieces fit. Bringing it in, good, and then releasing it long. Other side, sliding the right knee in, opening it out, keeping the pelvis even. Take that guy over the thigh. Take your fingers, get them in there, get them in there. Okay, holding on, and first we just start to make those circles. And then changing direction. And then moving it all around, stirring everything up. Got a lot of good pops on this one. And moving it in the hip socket. Good, and then releasing. And then just take a moment. Whew, I can feel it through the soles of my feet up. And that's your practice.